Panic disorder. Panic disorder is a type of anxiety disorder. It includes sudden attacks of anxiety and terror. Symptoms include shortness of breath, heart palpitations, trembling, dizziness, choking sensations, nausea, and an intense feeling of dread or impending doom. Anxiety disorders are the most common type of psychological disorders. 3% of Americans suffer from panic disorder in a given year. It is more common in women than in men. I have suffered from panic disorder for the last 5 years of my life. I was first diagnosed with anxiety until my symptoms put me in the emergency room on 3 separate occasions, believing that I was having a heart attack. Panic disorder can be a terrifying experience, especially when not knowing what is happening or causing the symptoms. I have been treating the symptoms with medication over the last 3 years, but have not been successful with treatments for the disorder itself. I would be interested in finding some successful treatment methods for panic disorder. I would also be interested in understanding more of the effects of the medications used for treating the symptoms, as some are addictive and can make the onset of panic attacks more prevalent when the medication is stopped. Those are 2 areas of interest I would look in further. The first abstract I found is called Diagnosis and Management of Generalized Anxiety Disorder and Panic Disorder in Adults. It states that the outcomes of treatment require a combination of treatments, like psychotherapy and medication combined. Cognitive behavior has been studied and proven effective alongside of medication. Physical activity has also been found to help alleviate the symptoms. The limitations of this study include the rates of misdiagnosis and misdiagnosis because the symptoms are often attributed to physical causes. The second abstract I found is called Drug Treatment for Panic Disorder with or without Agoraphobia, Systematic Review and Network Meta-Analysis of Randomized Controlled Trials. Its purpose was to identify drug classes with high rates of remission and low risk of adverse effects. Researchers concluded that SSRIs, or selective serotonin reuptake inhibitors, showed high rates of remission with low risk of adverse effects. Limitations here are that the findings were based on studies of moderate to very low levels of certainty of evidence, as well as inconsistency and imprecision of the findings reported. The third abstract I researched is called Effects of Caffeine on Anxiety and Panic Attacks in Patients with Panic Disorder, a Systematic Review and Meta-Analysis. It looked at the effects of caffeine on anxiety disorder. Researchers found that caffeine in doses of about 5 cups of coffee induces panic attacks in a large proportion of panic disorder patients. The results suggest that caffeine targets important mechanisms related to the pathophysiology of panic disorder. 51.1% of panic disorder patients had panic attacks after the administered doses of caffeine versus none that were given the placebo. Limitations in this study are that a wider range of doses were not administered to see a dose-response relationship for individuals. The full-text article I found during my research is called Moving to Beat Anxiety: Epidemiology and Therapeutic Issues with Physical Activity for Anxiety. It provides a comprehensive review of the relationship between physical exercise and anxiety, along with other stress-related disorders. People who are more active were found to be less likely to have anxiety disorders. Physical activity presents a promising addition to treatment for stress-related disorders. Limitations in this study are the key gaps in the literature regarding the mechanisms underlying the effects of physical activity and physical activity protocols. The website that I found was from the Mayo Clinic and offers a lot of information and advice to those suffering from panic disorder and panic attacks. It states that not everyone that has a panic attack has a panic disorder. There are other influences involved in the diagnosis that include how often a patient has a panic attack and to what extent it interferes with their functioning in society. The page goes on to say that the treatment can help reduce the intensity and frequency of attacks, and that main treatment options include psychotherapy and medication. Avoiding caffeine, alcohol, smoking, and recreational drugs will help keep attacks at bay. Getting physical exercise will have a calming effect and help with attacks as well. And sufficient sleep is another way to help avoid panic attacks. Limitations of this site include the fact that it is targeted from those suffering from panic disorder and those with panic attacks, so it does not provide a scientific-based evidence for the effectiveness of its treatment suggestions that it gives. In summary, it seems that a big help for people with anxiety or panic attacks is physical exercise, and that caffeine also has an effect on anxiety or panic attacks, and that psychotherapy and medication are the main ways that they are currently treating the disorder. References given.